Thank you and welcome to the show this morning. The topic today is domestic violence, and we're fortunate to have with us the executive director of the EJarrett House in Nashville, Tennessee, Miss EJarrett. And of course, Ms. Jarrett, let me welcome you to the show this morning.
Thank you.
And to tell you, Ms. Jarrett, how delighted we are to have you because you've been involved in a number of things throughout the city of Nashville and indeed throughout this region,
yes,
in a real sense. But in order to get into your new situation as the executive director of EJarrett House, let's have you to give our audience some information relative to your background, your education, and some of the things that were important in eventually leading you to the establishment of this house dealing with domestic violence.
Well, number one, I didn't establish it. It was already in, it's been in operational for 10 years now. But I worked in the healthcare field. I have about 40 years of experience. My degree is in healthcare. I worked at Access Health Systems for 17 years. Worked in Mahara for 17 years. So I've been a community person all these years. When Access closed down, they asked me to be on the board. And this is one of the organizations that we have started when Access was open. So I was a member of the board, and then I later became interim director, and now I am director.
Director of EJarrett House.
Yes, EJarrett House Incorporated, yes.
Let's look at some of the issues dealing with domestic violence and some of the reasons that you're here today to talk about domestic violence and such, Ms. Jarrett.
Domestic violence is still on the rise. 1.5 million women die every year, and that's according to what statistics you look at. Some of them count them as 2 million. And we were talking earlier, 800 and something thousand men witness or go through domestic violence. The reason why I have decided to come on your show is we need to put a different light on it. We need to include the men, because when the women go in shelter and they come out, well, the men are waiting on them. So while the women are in shelter, we need to do something with the men. We need to at least counsel them to see if they're amenable to stand in the family unit. If they are, we will get them help. So that's EJarrett's new mission, is to include the whole family.
And so in a real sense, the very, very fact of domestic violence is something that cannot be separated from men and women. And even though you might be able to shelter the woman, as you said before, she has to come back.
That's right. She has to go back out into that environment. You can keep her from 6, 8, 9, 10 months. You can even establish her working, put her in a house. But eventually, he's going to talk her into coming back to him. So the violence will reoccur. And that's because we don't do anything with him while she's in shelter. So it would behoove all of us if we would pay attention to trying to correct what the men are doing, because it's the men who carry the cycle. So if we don't help them, then we're never going to break the cycle.
You know, when we talk about domestic violence, I think that there's a tendency on the part of many people to believe that it's a social kind of activity and it has social relationships and et cetera. But I think that your experiences as a healthcare person,
it is,
have been involved in healthcare, working at Mahara. That's what I was thinking. Well, why don't you, from your perspective, dealing in health, talk about domestic violence from a health perspective, about how much it costs the state, how much it might cost the ER, or whatever, and et cetera, because a lot of folks separate that.
They separate that.
Good. Talk about, try to put it together for us.
When a man or a woman is abused physically, you have to go to emergency. If you have broken arms, broken ribs, a black eye, then you don't get to go to work. So number one, there goes the healthcare costs. Number two, you're missing work. So those two entities play into a big role of the economy. On the other hand, when a man or woman is emotionally abused, she has to be treated probably for the rest of her life because those scars will last. So there goes the healthcare cost up again. And don't mention what trauma you're doing to the children.
And so it's a real problem as we get ready to make this first commercial break, it's a real problem that is far outside of this whole thing about men and women being cruel and mean to one another, that it has a tremendous impact.
On the
As a matter of
healthcare.
fact, Meharry has moved into that direction to start talking about some of these issues as they will, I think as you've indicated, that what it does to ER and all across the board. And that's very, and I think that's a significant development.
It is.
If we can make people understand that. And
that it's all related.
Very good. That's why I'm so encouraged by the very opportunity we have to talk to a healthcare person who is also involved in domestic violence. And you can kind of pull that together for us. Of course, we'll be back with our audience following this first commercial break to have Ms. Jarrett to pull this idea of domestic violence and the health care cost that's associated with it after this first commercial break. We're talking about domestic